Assalamu alaikum doctors. In this video I am discussing a common case, that common abdomen in clinical MRCPCH, that is renal transplantation or kidney transplantations. So normally in renal transplantation renal examination we find the child is pale, jaundice presence, small for age, not clubbing, there is no clubbing present, multiple cannulation scars, we can find NG tube or gastrostomy tube, and feature of for rickets like bow leg, knock knee, wide wrist, these are. Then portacath can be present, long line, AV fistula very important, peritoneal dialysis, catheter or scar, urinary catheter, hypertension, sign of steroid and other chemotherapy toxicity. I am again repeating, generally renal transplantation we can find pallor, jaundice, small for age, there is no clubbing, multiple cannulation scars, NG tube or gastrostomy tube. Rickets we can find feature of rickets like bow leg and knock knee. There is portacath can be find, long line AV fistula, peritoneal dialysis catheter or scar, urinary catheter, hypertension patient, sign of steroid and other chemotherapy toxicity. So what are the sign of steroid we can find? That is like generally steroid toxicity are the short proportionate, obese or overweight, normal mentality, specific features, there is precocious puberty in male and virilization in female. And if we go to hand, we find in Cushing syndrome there is skin are thin and shiny, visible blood vessels, skin atrophy occur, proximal myopathy in the arm or do maneuver of squatting, do it, check power of the upper limb. There is axillary hair, we can check. Head and neck we can find acne, hirsutism, moon face, alopecia, malar rash, mouth ulcer, stria, bruises, chest auscultation, these are we find. And there is interscapular pad of fat at the back, we know that. Spinal deformity like kyphosis, kyphoscoliosis. So, and stria mark. So these are the feature of Cushingoid features we find in renal transplantation plus Cushing. A local examination to find scaphoid abdomen and the most important nephrectomy scar in the renal angle. Remember, nephrectomy scar in the renal angle, holistic like incision, hockey stick like an incision. Okay, and also find scar above the mass of implanted kidney in right iliac fossa. Now, what are the investigation we could do the renal transplantation? First of all, I will do the renal function test, albumin creatinine ratio, ABG, and electrolyte, especially the potassium. GFR we do, GFR glomerular filtration rate. Chronic renal failure we call when GFR is less than 60 ml per minute per meter square for more than 3 months. Above full blood count we do, anemia of chronic disease, normocytic, normochromic, and iron profile for iron deficiency anemia. We do the coagulation profile, calcium profile and vitamin D deficiency, urine analysis, 24-hour urinary protein. Radiology, we are doing abdominal ultrasound, KUB for size and shape of the kidney and calculi, DMC scan and MCUG, then X-ray of the wrist for rickets and renal biopsy. So main investigation, if they ask, we call that urine analysis, we do GFR, full blood count, we are doing the coagulation profile, calcium profile, vitamin D, the radiology abdominal ultrasound to see the size and shape of the kidney, DMS scan, MCUG, X-ray of the wrist, and the last is biopsy. Then what are the causes for indication of renal transplantation? Renal transplantation we do in stage of renal disease secondary to like congenital and acquired causes. Congenital polycystic kidney disease, dysplastic kidney, Alport syndrome, acquired obstructive uropathy, malignancy, SLE, nephritis. So in indication of renal transplantation are polycystic kidney, dysplastic kidney, Alport. These are the congenital cause, and acquired obstructive uropathy, malignancy, SLE, and nephritis. Indication for hemodialysis are volume overload, uremic encephalopathy, and uremic pericarditis. Now, what are the pericarditis? What are the complications of renal transplantation? These are rejection, infection like cytomegalovirus and pneumococcus. PCP are the common cause of death in first year of after transplant. Obstruction, hypertension, electrolyte disturbance, bleeding, malignancy, complication of chemotherapy medications. If the cause is autoimmune disease, relapse may occur and reject the transplanted kidney. So obstruction, rejection, inflammation, malignancy, bleeding, infections, these are. Treatment management, first I will involve the multidisciplinary team, nephrologist, endocrinologist, dietitian, psychotherapist, social worker. So nephrologist, endocrinologist, dietitian, psychotherapist, social worker. Treatment of the reversible kidney injury, like prevent the progressions, control the blood pressure, maintain the normal electrolytes, treatment of infection and anemia. Treatment of complication, we do the salt and fluid restrictions, hyperkalemia. For hypertension, we are giving diet, diuretics, AC inhibitor, acid-base balance, diuresis. We can do renal osteodystrophy, low phosphate diet, phosphate binder, calcium and vitamin D3. failure to thrive, nutrition, growth hormone, correct acidosis, and anemia. For nutrition, we can avoid the protein restrictions, take iron, zinc, and water, vitamins, and for anemia, we give the erythropoietin, iron, folate. These are for renal replacement therapy like dialysis, transplant. These are the management. Advice very important. What are the advice we give renal transplanted patient? These are avoid nephrotoxic drug, NSAID. Paracetamol is very safe. Avoid dehydrations, give plenty of fluid. Avoid infection with varicella. If infected with symptoms, so IV acyclovir. No symptoms, IV immunoglobulin. Lab attenuated vaccine are contraindicated. Prophylaxis with co-trimoxazole. Then clinical reviews regarding blood pressure, growth, jugular venous pressure, lab test, and regular monitoring of creatinine. These are causes of fever in patient in renal transplantation are UTI, infection, rejection, UTI, obstetric uropathy. Then if on dialysis, rule out peritonitis. If diarrhea, rule out hemolytic uremic syndrome or gastroenteritis. So this is all about renal transplantations. It frequently come on exam. Thank you.